Michael Tildesley. He's an Associate Professor of Life Sciences at the University of Warwick. Michael, thanks for your time. Now, the WHO is citing evidence that teenagers can infect others in the same way as adults. Do we know what this evidence is?
I personally don't know exactly what this evidence is that the WHO are quoting, but there is some suggestion certainly that teenagers in particular are mixing in quite large numbers. So it's not necessarily that when an individual child over 12 gets infected, they are equally as likely as an adult to pass that infection on. But a lot of it is actually this increased mixing with older age group children. They tend to not be observing social distancing perhaps quite as much as the younger age groups, and mixing in larger numbers. There is therefore the risk that they could be transmitting the virus at a higher level than has been previously thought.
Now, Michael, children at least over the age of 12 and teenagers are mixing because of these relaxed lockdown measures that so many countries have now implemented. And looking at a country like the United States that has such a high number of infections, in September it's also looking at reopening schools. So how does this new information from the WHO affect the opening of schools, not only in the US, but in so many other countries that are looking to ease measures in the coming months?
Well, I mean, I will say first and foremost, I think like the vast majority of scientists in my research area that opening schools is extremely important. I think we need to do what we can to make sure that children get back into school, because the long-term damage of children being out of education is extremely large. I think what it tells us, though, is that what we might need to do is be a little bit more vigilant. So when children do go back to schools, we may need to put measures in place. And if necessary, we may need to make some difficult decisions regarding tightening restrictions in certain areas or certain sectors in order that children can go safely back to school.
And what would you suggest that some of those difficult decisions, as you describe them, actually are?
I think that's extremely difficult, and I think this becomes much more a political rather than an epidemiological question, because I understand that in the UK, for example, there has been some discussion of maybe particular sectors might need to close again. So, for instance, say pubs and restaurants might need to close to allow schools to reopen. I think that's very difficult for me to call that, because I completely understand that there are many other factors, economic factors at play that mean that the government will be reluctant to do this. But it's very, very clear that we are at a very, very critical phase. Cases in many countries are starting to climb. We want to make sure children go back safely to school. And so these difficult decisions are going to have to be made over the coming weeks to make sure that that can happen safely.
Certainly some very difficult decisions to be made there indeed. Michael Tildesley, thanks so much for your analysis on that.